Kimberly. Thank you so much for joining us today on this conversation and to celebrate World Health Day with you. It's an honor for us to speak to the founder and also the executive director of Kimberly's Touch. And I think it's a great opportunity for us to understand why why is it called Kimberly's Touch.
Thank you. Thank you. Thank you for having me. Thank you for being interested in the organization as well.
Awesome. And now I want to just start off with understanding a little bit more about your nonprofit. Firstly, where did the term Kimberly's Touch came from? Why is it called Kimberly's Touch?
First off, my name is Kimberly. I am a cancer survivor, 10-year cancer survivor. Once I went into remission, I started working at the cancer clinic where I got treated at. And I built a lot of relationships with different patients. For some odd reason, every patient that came in wanted to speak with me as if I had a sign on me that says, you can talk to me. And they would tell me what their struggles were and their concerns were. They would ask for resources, and I would do my best to help them with resources. When I saw there were not enough resources out there for all cancers, I prayed about it, and I just stepped out on faith and started an organization called Kimberly's Touch. So, like I said, my name is Kimberly, and everyone has told me to put touch to it because I touched their lives in so many different ways, but in a special way. So that's why it's called Kimberly's Touch.
Awesome. It's almost like you have a healing hand, and that's what it resonates to someone who hears it for the first time. And I want to understand the broader meaning of it. In what way and in what ways are you a nonprofit helping people get accessible resources? How do you exactly help people who are diagnosed with cancer?
So how we started was we connected with social workers that work side by side with these patients. And if the social worker found that they are actually struggling financially or emotionally, they would send us an intake form. If they need help with a light bill, they will also submit the light bill. We will pay that light bill, and we will send them their confirmation number or their receipt back to them through the email. We'll also send a copy to the social worker so that the social worker know that it was done. If we don't have the resources for them, we'll let the social worker know, and then she'll start looking at other resources and hopefully that someone else can gather and be able to help that patient.
Now, Kimberly, just to understand a little bit more, that you mentioned that patients struggle financially a little bit. So, if you could just maybe tell us a little bit more about the challenges that the current healthcare system has when it comes to dealing with cancer.
So, like myself, when I went through it, you never know. No one is exempt from this disease. So my husband and I, we had a nice savings account. But when I got struck with cancer, it took down from 2 incomes to 1. So we depleted our savings. So when someone has, saved up for so long, and when this cancer strike, and you don't have cancer insurance, because I didn't have cancer insurance, because I didn't, think I was going to ever get it, you end up having to use that money to make ends meet, get the medicine you need, get the right types of food that you need. And once you have depleted that and you're no longer able to work because of the chemo, you have found yourself in a unforeseen, situation, and you may need that help from someone. You may need a little boost, and it's not like they need it all the time, but to start off with, you start struggling, you get depressed, you're wondering where your light bill money is going to come from, where the food is going to come from. As a matter of fact, we started a food bank here in my garage for patients that need services as well. You just never know when a patient may need something.
That's so heartbreaking to hear. And as you mentioned that a lot of people don't have cancer insurance, and because people think they're never gonna get it. Even for me, why would anyone ever foresee that? So would you recommend that people do that, or are there any maybe lifestyle habits or changes that you would recommend to people?
Well, I would recommend anybody to get cancer insurance because you get the lowest policy, just to know that you have it. So if it ever occurs, you are having and you don't have to worry about it. As for lifestyle with eating, nutrition wise, eat healthy. Do I eat healthy all the time? No, I do not. I mean, I try, but there's certain things I like. When I got diagnosed with cancer, I must say I was addicted to Mountain Dew. It's a soft drink. Yes. I stopped drinking that for a long time, but every now and then I treat myself to one because everything that we're going on in the world, you get stressed out. And to me, Mountain Dew is very comforting to me. I don't drink it every day like I used to, but once a month, once or twice a month, that's about all I do. But as far as eating, me personally, and this may sound funny, I was told that I got cancer from one of the things I ate. My mother fed all 4 of her kids the same thing, and I'm the only one in the family that got cancer. So my scenario is, how in the world did that happen, And I'm the first one in the family that has gotten it. So I don't know. Could have been the Mountain Dew. It could have been.
It's okay.
But eat healthy, drink plenty of water, lay low on the sugar, vegetables, smoothies, things like that is what I was told to eat. So I have kind of like, we don't eat too much fried foods in our house anymore. Everything is basically baked or grilled food. So that is a good change that we have made also. And we drink lots of water.
Thank you for those tips, Kimberly. Now I want to shift the gears a little bit more and understand another aspect of cancer in US. So we're just going through some facts, and it said that African Americans, they have the highest death rate and shortest survival rate of any racial ethnic group in the US for most cancers. And I want to understand from you if you personally faced anything, and also if you hear stories like that when people come to your nonprofit now. If you could just walk us through that scenario?
Well, that scenario is a scenario that I can't say that I have not met, but I have. But I get it from both ends. But from the research that I've done, yes, they say African Americans, we stress too much. So we're likely to die. And then we're the ones that sit back and we stress about where our funding coming from. Because if you sit back and you read about it, it's not the cancer that's killing you. It's the stresses that come along with the cancers. Like I said, we sit back and we wonder, where is our next meal going to come from? Who's going to take care of our kids? Are we going to be able to live in a house? I met so many people that have been evicted from their homes. They're living in their cars because they don't have a job anymore. They've been sick for so long. Disability don't pay as much to keep a house over. Now with the inflation, they're really going to need the help, So I've met some generous African Americans, Caucasians, Asian folks that's going through the same thing. But the statistic wise, yes, African Americans are the ones that are most likely to die from the cancers. Why? I have no idea why that is. I have my thoughts, but they haven't been clarified.
All right, thank you for sharing your perspective on this. And now that we have covered all the bases, I want to understand, how can people support your nonprofit? We know why it's important. We know why it's an issue that needs attention. So, what are the ways that individuals, companies, college students, how can everyone support your nonprofit?
Get involved and give back. It's a saying that when you know better, you do better. Improving the overall quality of health starts with reaching out to the community. So getting involved means, you can volunteer, you can donate. It doesn't even have to be a lot. $5 will go a long way. Those $5 add up. There are so many people that have been affected by this disease. It may not be you, it may not be me today, but it could be. Nobody never knows. Like I said earlier, no one is exempt. So volunteering your time in a nonprofit such as Kimberly Touch, it helps you gain a greater understanding of what we do, how we do it, and what the patient goes through. Not everyone is affected by cancer the same way. Everybody don't get the same treatment. Everyone don't get the same chemo. So you get to actually see what a person goes through when they're going through treatment. When I found out when my cousin was going through brain cancer that not everyone loses their hair. It just depends on the type of chemo you get. So not everyone loses their hair. I lost mine. Exactly 14 days after my first chemo. But until you have walked the journey or had a loved one affected by this disease, no one really knows the real struggle that a person goes through. So not everyone has a family or support system to help them get through. That's why Kimberly's Touch is here. The thing about it is, I may not know this patient until I actually start working with this patient, but this patient is not a number to me. That patient becomes a patient, a client, and a family member, because we don't let them go. Each month, we actually send out all our patients' birthday cards. If they got a birthday in April, they receive a card from us. We want them to know that we care. They're not a number.